We're going to finish, clearly, as you know, we're going to finish at 1 o'clock. And we're at the welcome stage for myself, Martin Howard, at the moment. And then we were discussing earlier whether Tim or Sarah should be in a different order, but it doesn't matter too much. But we're certainly going to hear from Sarah Fishburn, who's ready and on the line, who's going to give us an overview of the projects and progress, but particularly focusing on the ones that will be of most interest to you. And then Tim, who's joined us. I don't know if Tim's got your microphone on yet. Not sure he has, but I hope he will soon. Tim will be joining us from the communications team in NHS England South to look specifically at these new concepts called sustainability and transformation plans, and particularly how local maternity systems, yours, will need to, and the potential for how you link in with those. So that should give you a bit of insight into how you can be more influential, which is the whole aim of today. So it's bringing people together who are working ardently in your own local area, and this is a chance to learn across the patch from whichever bit of the south of England you're in. And I hope go away feeling a bit more empowered and able to make a change locally as well. So that's the overall aim of today. And as Tim, I don't think, has got his microphone sorted out yet, I think we better move straight on to Sarah. So in a moment, I'm going to ask Sarah to do her overview and introduce herself as well. So Sarah, just passing over to you.
Thank you very much. Thank you for the introduction.
And you'll need to choose across the top tab, Sarah. You'll need to choose your presentation rather than mine as well.
Okay.
Where it says national.
It says national. Yeah, there we go. Thank you.
Yes, thank you, Sarah. Yeah. I'll put myself on mute as well.
Yeah. I can see Tim now. Tim, have you got your audio working? We can't hear you. Hang on. Martin, can you help Tim with his sound? Because it sounds like he looks like he's not.
I'll message him in the chat box.
Okay.
So let you carry on, Sarah.
Yeah, I'll make a start then. So thank you very much to everyone for joining us and for getting through all the technical hurdles of getting onto the WebEx. What we're hoping to do is start with a national picture, which is why we were hoping that Tim was going to make a start on the presentations. And then I'm going to feed back about the regional update and have a look at the regional picture. And then we're going to have an opportunity for the last part of the session to discuss that and discuss your issues and ways of linking you in with your local maternity service. So that's the aim of what we're going to do now. I'm just going to make a start on the presentation and talk about the national update. Susie Crow's also here. And she's been to the most recent meeting, which happened yesterday, about implementing better births in the south. So she's going to give us an update as well on that. So we spoke last time about the maternity review and how that's being implemented. And it's being divided into 9 work streams, and each work stream is being allocated to a different set of people to work on. And the aim is that local change will occur through those work streams. So the first one is about the local transformation, and that's the one I'm going to focus on now. I have included all the other work streams at the end of the presentation, so if you want to look at those in more detail, they are available to you. But we're just going to talk first about the initial stage, really, which is the local transformation. And we talked last time about the STPs, the footprints of these sustainable transformation plans, which is about creating a system around a population and joining up services so that some of the boundaries and the boundary issues can be addressed, because we know that particularly across maternity services, often there are barriers between maternity services, so looking at how those can be addressed. And what's going to happen in the maternity world is that they're going to be local maternity systems, so LMSs are going to be called, and they're going to fit into the STPs, so the Sustainable Transformation Plan patches. I hope that's all making sense so far. And what's going to happen, the way that's going to happen is there are going to be a group of early adopters, and some of those are in the south. So we'll have a look at the map in a moment. But the aim of the LMSs is to look at involving the people using services, so women and representatives, service user reps, commissioners, and the providers, so the actual hospitals themselves or the trusts themselves, in discussing that. And that's the bit that's bit under discussion at the moment, looking at what the best way to do that is. There have been some discussions about how to structure the MSLCs, because at the moment MSLCs tend to be trust-based, and we know also that there are some MSLCs that have either been closed or aren't functioning in a kind of standardised way at the moment. So it's looking at how that would work in these LMS systems, and I think that's really some really important feedback that you can feed in about how you think that should look going forward. So the aim of implementing this process is about improving choice and personalisation of maternity services. And that this is based on the Better Births. This is what they're trying to implement, making sure that all women have a personalised care plan, that they can make choices about maternity care during pregnancy, about their birth and postnatally, and that most women receive continuity of carer, so it's the person caring for them during their pregnancy, birth and postnatally, and that there are more options about place of birth, so that women are really offered choice, really as set out in NICE guidance. So that's about the choice agenda. There's then also a safety agenda, which is looking at halving stillbirth and neonatal death, halving maternal death and brain injury during birth by 50% by 2030. So that's the main, or the first of the safety agendas. And they're doing that by investigating and learning from incidents, and sharing this around the LMS, and that could be one of the advantages of the larger spread of an LMS, because you can learn across trusts and share that learning. And then they're also going to be fully engaged in the development and implementation of the NHS Improvement Maternity and Neonatal Quality Improvement Programme. So those are the safety issues. So we've talked about the LMS and then bringing together commissioners and providers. The clinical networks are the next stage of that. So they have responsibility for providing the clinical expertise and supporting the LMSs. And then the regional boards are going to oversee and support this delivery by LMS, generally across the STP footprints, although I think there are some areas where they don't quite coincide. And then the national board is coordinating all this in line with the Better Birth vision, and they have a programme team. And I think Tim might be able to give us more information about that when he's speaking later. Okay, so within the South, we have some of the early adopters, and I think you can see them on the map here. So we've got Dorset, which is the STP includes 3 providers and 1 CCG. Surrey Heartlands has 3 providers and 3 CCGs. And then Somerset has 2 providers and 1 CCG. So those are going to be the early adopters in our region. So I'm not sure whether we've got some people on the call who are from those areas. It'd be really helpful to have feedback from them about involvement.
Sarah, do you want to ask people just to pop something in the chat box as you're talking about whether they're in those areas?
Yeah, that would be helpful.
Yeah?
Yes.
Okay, let's see. Good to do that.
That's all right. Well, I've got to any questions from the
Okay. Good. Thank you, Sarah. So that is the question. Any questions? We're just going to leave 2 or 3 minutes now for questions because after we've heard from our colleague Tim around the STPs, jargon busting here, there's lots of time for discussion later. So any kind of top questions or remarks that come up there, and I'll leave the slides with Sarah so she can refer back as well, either by phone, but you need to take yourself off mute with a little microphone symbol or something in the chat box, either way. Any questions or queries? Could use your hand putting up as well, but I can't see any hands being put up. That's very polite of us, isn't it? But it's not very polite if nobody puts their hand up. Any questions at all at this stage? If there are, put your hand up or put something in the chat box.
Yeah, maybe we need to look at the national picture and then get Susie's feedback and.
Sure.
Yeah.
Should we do that then?
Yeah.
So if I'm going to take Tim off mute. Hello, Tim.
Hello, can you hear me?
Yes, I can hear you, so I'm assuming everybody can. So nobody apart from Sarah and Susie know you or know who you are. But I think you haven't got any slides. Is that just to check that with you?
Bear with me. Let's just see whether this one pops up. I've just tried
well, you're not
share
in
a new whiteboard
yet.
Of so many things in life.
Yeah. So Sarah, could you move the little globe? Tim, you are now. You are now. It's happened.
Yes.
You've grabbed it. Fine. Yeah. So Tim, if you'd like to introduce yourself, and we've got a whiteboard, which is very tantalising.
Can you see anything? Anyway, hello, my name's Tim Wiseman. I'm the Regional Media and Briefings Manager at NHS England South. So primarily my day-to-day job is the coordination of the way that NHS England South responds to and manages items in the media. So that could be running stories such as winter pressures. It could be patient safety incidents. It could be our proactive campaigns from prevention agenda activity through to information for the public, and also supporting a wide spread of engagement and consultation activity in trying to make sure that patients and service users and families have a full say over the services that they receive. And obviously NHS England is both a commissioner of services and assures our local clinical commissioning groups on the services that they commission. It is a complicated beast as far as the commissioning picture looks, but so that's my day role. Across the region, we have communications professionals like myself who are allocated to certain programs of work. So NHS England has a range of priority programs, from the obvious ones like cancer, diabetes, stroke, through to other activities which we are delivering that are more of a local nature. Now, the maternity services priority has recently, there's now a maternity program board at the South level, and that's and Sarah's already touched on some of that activity. So there are structures in place here at NHS England, and that and they're being mirrored from a national, regional, down to a local level. And from a communications perspective, that's our team's role is that we provide each of those program areas support as well as doing our day job. So that is giving them the professional communications advice that are needed to help help the programme engage with stakeholders, engage with patients and public, and also, of course, try and promote our successes wherever we can. At the moment, we're all extremely busy on winter, but the aim today was just to give you a very brief overview of some of the elements that Sarah's touched on sustainability and transformation plans. It is the new way of thinking for the health service, but most importantly, it's not just about the health service, it's about joining up an integrated approach to health and care and starting to think about the boundaries in a different way and the way that health services are delivered in a very different way. Now, I'm not sure if is anyone actually able to see anything. I have tried to share my screen, but if not, it does not matter too much. I will ping this around.
Completely white.
So I'm not quite sure where participants are from across the south, but if you're familiar with our region, obviously we cover from sort of Buckinghamshire, Oxfordshire, and Gloucestershire out in Bristol, right the way down to Cornwall and across to Kent, over to Kent, covering Surrey, Hampshire, Dorset, Somerset, Devon, etc. The STPs, there are 44 of them nationally, and here in the south there are 13. And I will send this slide around. If you can't see it, is a map of the south and how they're broken up. So I'll just quickly whiz through them, just so those of you on the call can identify with where you are. So Buckinghamshire, Oxfordshire and Berkshire West is one. Frimley Health is another. Surrey Heartlands is another. Kent and Medway is another. Sussex and East Surrey. Hampshire and the Isle of Wight. Bath, Swindon and Wiltshire is one. Bristol, North Somerset and South Gloucestershire is one. Somerset on its own is one. Dorset is one. Devon, and then Cornwall and the Isle of Scilly. That makes up the 13 STPs of the south. And each STP is led by a nominated STP leader, and they generally speaking are the accountable officer of the one of the leading clinical commissioning groups in that area. That's not entirely true. Some of them have acute trust leads, and I think we may have one lead, which is the local authority lead. So that is your leadership, and those leaders are doing this on top of their day job. So they may, as I say, either be working in a CCG, or they may be working in a trust or in a local authority as their day job, but they are ultimately the system leader. And that point about it being a system is what is most important. It represents the health and care partners within that local system, and STPs are an attempt to move away from very isolated planning on a commissioner and individual healthcare provider, so a hospital basis, and instead of them just doing their operational planning based upon their own activity, that they come together, and most importantly, they come together as health and social care, come together and do their planning on a place-based approach rather than an individual organisation approach. Because we know, and as you've seen in all the newspaper cuttings, and winter is a prime example, where social care, if you don't get social care right, you'll see the impacts on NHS care. And to a degree, that's a microcosm of what the STPs are trying to address. Of course, they have a much wider, more strategic, all health, all care focus. But if you can bring together organisations and work together to bring about the efficiencies that are required and to do things differently, that is the way by which we will deliver the 5-year forward view. Now, the 5-year forward view is a strategy that was put together, published last year, that sets out how both NHS England, together with the other national arm's length bodies that deliver health services, how we'll work together to essentially to move the health service from where we are currently into a new way of working. One that is, principally, it's about bringing much more join up of services, delivery of care closer to home, of integrating services where we can, and ultimately it's about delivering efficiencies and improvements in the quality of care. And through that, there's no doubt about it, it will also deliver financial savings, and we'll have to do that because of the financial envelope that we are operating in. So hopefully, does that make sense? And as I say, the STPs as partnerships beneath that strategy are the way by which a place-based approach will deliver that strategy. So they are delivering their own operational plans that will sit underneath that local STP. And in October last year, the STPs submitted their draft plan as to how their boundary, how their local partners are working, what are their priorities, what are the emerging elements that they look to change. It may well be that they're proposing changes to community services. It may be that they're changing particular elements of their acute care. So, for instance, stroke services may need to be changed, to be improved. And each of the STPs has very different challenges, and they're starting to develop emerging proposals on how they feel they could tackle those challenges, not least the financial challenge. One that is dealing with ever-increasing size of population, elderly population with longer-term conditions, and as I say, the financial challenge that every organisation and every system faces as it tries to deal with that population increase and that increase in demand that we all know about. So that was back in October. Every STP now, that includes all of those obviously in the south, have now published. At the very least, they have published a narrative essentially, which sets out the case for change in their local boundary. So in nearly all of them, the case for change is exactly that: rising demand, challenging financial situation, and the need to improve services in a new way. It sets out that case for change, and it starts to set out the priorities that the partnership group have started to identify. And now all of this has already been built upon much engagement with local populations and communities, patients, service users, either through pre-run engagement campaigns or through new activity that has been started as a result of the STP process. Now, I will share with everybody who's a member of this call and others after the call. I'll share some useful links. So if you're in a particular area and you're interested, you can go and have a look at some of those published public narratives that every STP has created. And they're in the main, we've worked very hard to try and get them to a point where they are publicly accessible, so that you can clearly read them. You can see what the case for change is. You can understand it sensibly. You can see what some of the emerging proposals are, and also you can start in your local area. You can, where it's appropriate, where they've opened some engagement processes, you can start to have your say as well, and you can start to feedback. And we really need your help in trying to drive that engagement with not just yourselves, but obviously with the work with the local maternity systems. So I'll send that round afterwards. All of those are essentially developing plans. This is a longer-term piece of work than just one plan published this year. It will continue to evolve. But what we will see is each of the systems are in slightly different positions, and some of them will be moving towards formal consultation as they start to narrow down particular priorities and particular proposals for service change in their area, which in many instances will involve maternity services. This comes back to Sarah's earlier presentation. And again, the most obvious one in our region in the south currently, which has generated a lot of media coverage and a lot of public interest and a lot of public concern, is it surrounds the Horton General Hospital in Oxfordshire, where there is under the Oxfordshire Transformation Programme, there are proposals that, around moving towards a midwife-led unit at the Horton, and a consultation is due to commence, if it hasn't opened already, on some of those proposals that the local STP has begun to develop with those local partners. So it's a case in point of what we will start to see happening across all of these STPs as time progresses, and that may be on specific elements of service like maternity. So it is well worth staying engaged with the development of your STP in order to keep in touch with any proposals around maternity services. And similarly, I think what we need to make sure that we do is we're taking advantage of this network that is running now and making sure that we do our piece to plug you into local STPs as required. And then and progressing over time, as I say, I would say that over the course of the early months of 2017, we'll see more and more of these systems move towards moving their proposals from core proposals into actually engaging with the public, to starting to say, what do you think about these proposals? And then into, right, we've decided on what we think the right proposals are. Now we're going to consult formally prior to service change that may follow over coming years. As I say, some of them are in different states, some of them are further forward than others. It's worth, if you're in Devon, Devon is already running its consultation on services locally there. They were much further ahead because they were part of the success regime, so there was already a lot of work going on to look at reconfiguration. How could they make services work better in Devon? And similarly in Dorset too are quite far ahead, because they had a whole review of clinical services, which essentially again looked at many elements of how they could improve services. So they're a bit further ahead than others. But broadly speaking, if I will send those links around, and I'd strongly recommend that if you've got localities that you're interested in, that you do read those STP narratives, and you keep in touch with us, and we'll make sure that we keep you informed on any elements that you're interested in.
Tim, I'm going to draw you to a close in a second.
Yeah,
oh, good.
That's probably about it. I
Great,
don't think there's much more to add, other than we'll continue to see the STPs as the approach by which NHS England structures its work. More and more of our time and more of our effort will be on those boundaries. So whilst as NHS England works across 4 local offices, more and more we'll be focusing on those STP boundaries, and you may see your local organisations doing the same. The STPs and those boundaries and those partners within them will hopefully become the new way of working. So it's worth familiarising yourself with all their work.
Thank you, Tim. You can stay with us, I'm sure. Can you? Can you stay with us?
For about 10 minutes, yeah.
Oh, right, okay, great. So perhaps if we direct questions and discussion towards the STPs in the next 10 minutes, if it doesn't continue beyond then. Lisa, I saw that you had your hand up, and I hope that was a question. So was that a question, Lisa? Because we're over to you if it was. I can hardly hear you, though. Lisa? Lisa? I think we're not really getting your sound, so I'm going to put you on mute again. If you could just type your question in the chat box, that would be great.
She's just sent a message to say she's in a cafe. So.
Okay, thank you. So, but we have had a number of issues or things coming up in the chat box. I wonder if both Sarah and Tim, you could look at the chat box, which I wouldn't be able to summarise, but I think one of the things that's being asked is, to what degree do you think local current organisations, and of course we're talking about maternity services here, will need to change or may change both their structure and their footprint? In other words, I wonder to what degree the STP will be changing structures as well as obviously prioritising investments and improvements. Tim?
Yeah, so individual STPs are, I'm just having a quick flick through some of the comments in the chat box there, and some have noted that some of these STPs are geographically huge, and it is without a doubt one of the challenges that many are facing, is that they cover very large geographic areas, and as a result they combine multiple complicated partnerships. If you look at so Kent and Medway was referenced in one of these one of the chat box comments there. I think that's from Hannah. It's huge. It's multiple local authorities, multiple providers, multiple commissioners, and that makes it very difficult. And I don't think we can really shy away from that. And what the STP will have to do is work out how it can make the most of the breadth of experience and people that it has involved in it, whilst at the same time not being completely hamstrung by that complexity. I think if you look at Berkshire, Oxfordshire and Berkshire West, the BOB footprint as it's known, they have the STP itself is almost broken down again. There's a tier beneath it, which is where the individual counties have developed their own plans which essentially the STP is the umbrella that sits across the top of them, they all contribute to. So I think it will depend upon each individual STP area and ultimately the personnel that are working there around how that will be done. But yeah, some of them are very, very large, very complex. How they start to draw together some of these particular areas of work, such as maternity, and how they make that fit within the geography that they cover, I think needs to follow. I think it's just worth noting that they do cover big areas, and there will need to be a bit of subdivision, I'm sure, within them.
Thank you. Sarah or Susie, would you like to add anything? Susie, you haven't introduced yourself, if you'd like to say anything.
Oh, hi. I'll probably give an update on what happened at the regional board after everybody's finished their questions with Tim, so I'll probably keep myself quiet for a moment.
Fine, that's fine, yeah.
There was another one there, Martin, from Lisa around communicating the Better Birth plan.
Yes,
what's being done. And I'll be quite honest, I don't know. I'm still, so there is when I was mentioned earlier that in the south, at a regional level, we allocate an individual to each of our priority programs. Now, maternity, we literally just this morning have discussed how do we've been requested, can we provide comms support and develop a comms strategy to support the maternity work? So at a south regional level, I think it is early days, but yes, I think we now recognise that we need to give some support to what is obviously an evolving programme. So watch this space on that one. Specifically on Better Birth, it has been very much a nationally held plan. So I will touch base with, and I know that Jane Cummings, the chief nurse, and Susie can probably help out on this one. I know that it sits with Jane Cummings, national, who's the NHS England chief nurse at national level. And I've not seen a great deal, I must admit. So I will do some digging, and I will again drop a note back round to this group afterwards about what's been done and if there's any further plans going forward.
Thank you, Tim. That's good news. That's part of what we're trying to do here, is to communicate locally, nationally, and regionally. And so thanks for doing that. Thanks for offering to do that. Any other questions as Tim's with us for a little while longer? Any questions either in the chat box or by putting your hand up? I know Lisa's hand's still up. But, any further?
If just before I go, whilst I will think of any extra questions.
Oh, we have got one from Laura, actually.
Oh, great. Okay.
Sorry, Tim. Yeah.
Just go on, Laura. Go ahead.
Laura, hi.
Hopefully you can hear me. I hope I'm coming through.
Yes. Can you just introduce yourself and go ahead?
Hello. My name is Laura James. I'm the outgoing chair or former chair of Bromley MSLC, and I'm still heavily involved, and I also sit on various regional bodies as well. I think that the point I just want to make sure that everybody's kind of aware of here is that as a former chair of an MSLC who's been trying to encourage service users to join our local MSLC, which just covers the Bromley area, so the Bromley Borough, and one trust, it's actually quite difficult just to try and engage women with, the service that they themselves have used. I think it's going to be extremely difficult to engage women on a more regional basis. The average woman who has just birthed her baby and wants to help improve that service that she used for her friends and her family and in her locality, it's going to be very, very difficult to try and get her engaged on a regional STP level. So I just wanted to make that point and make sure that everyone was kind of aware of that challenge.
If I can come in on that, I think that's one of the biggest challenges facing the MSLC and within the LMS footprints. So I would agree. I can't elaborate any further on that, but I just think that is a really important thing to get across. I would agree.
And I think that's why we're quite so adamant that, that the MSLCs at local level still need to exist, because, at an LMS level or an STP level, these are, they would be kind of worthless and meaningless unless the local issues and what the local women are saying are fed into them.
Yeah. I wonder whether, coming back to Tim, Yeah.
I would stress that the STP is a strategic level, and so there will always need to be that local activity, without a doubt, in support of both your local groups that are already acting, your local in the local providers on an individual basis. The challenge will be, how do you draw that all together for the benefit of a bigger strategic approach? It may not change some of the stuff you're doing locally immediately, directly. It will sit above it.
Well, I'm really, really encouraged to hear you say that, that there needs to be that local level there as well. That's great to hear.
Thank you. We're having loads of good stuff in the chat box from Lisa, Hannah, and others. Does anybody want to turn any of that into a question as well, or a discussion point out aloud? Sally, I think you've got your hand up, but I'm not sure I've got any audio connection for you. Sally, are you there, or are you just... No, I didn't think so. So let's continue the discussion. Is there anything further for Tim before I think he does need to leave quite soon? Got some, as I say, some great points coming up in the chat box about funding being an issue, not necessarily everywhere, but certainly where some people are pointing that out. But sticking to Tim's kind of area of expertise around comms and the STPs, any further questions or discussion points? You're being asked for an opinion from Lisa. Come on then, Tim. What's your opinion about funding MSLCs?
I'm afraid that is well and truly out of my remit. So no, apologies, I can't really provide any insight.
No opinion available there. Susie, I'm going to ask you because you've been asked. Sorry, Susie.
No, I know that the patient experience team, remember when Rachel was on the last call, Rachel White from the central team, she said that the guidance for MSLCs was going to be updated and republished. So I'm just in the process of sending her an email now just to say, where are we with that? Because I think that's, an interesting starting point to look at funding for the future, because they must have had those thoughts when they rewrote that guidance.
So that sounds good news. How are people feeling about their degree of influence? That's a broad question, but has anybody got any views on that? Because I feel that's, and we've had that discussion just now about local influence and regional influence, and how some people will be interested in one aspect and some in the other. What's people's general feelings? Anybody like to chip in? Am I seeing any hands up? Lots of typing. Great. Lots of good examples of good practice. Anybody wish to chip in about their sense of influence and how that might be something that could be improved by networking, for example, as we discussed in our previous web seminar before Christmas? No? Any? So Tim, I feel like you might need to leave. Is that?
I'll
thank you and say goodbye.
Do please circulate my email address. That'd be helpful. And I'm more than happy to pick anything up. And obviously, I work with Susie here in Reading, so I'll send that round. Thanks very much.
Absolutely great. Thank you for joining us, Tim. Cheerio.
Bye.
If you'd like to log out, that'd be great. So I think Tim's on his way there. So Sarah, any points you want to pick up either from the discussion or to look at any of the updates that you hadn't mentioned?
Well, I think it would be helpful at this point to ask Susie to feedback from the meeting yesterday.
Okay.
Yep.
Is that okay with you, Susie? And it'd be best if you introduce yourself, even though lots of people do know who you are. Thanks.
I'm Susie Crowe, Regional Head of Quality, but I'm leaving my post next week on Friday, going back to Gloucestershire Hospitals to be the Head of Patient Experience. So this is my last week, which is why I was just hiding in the background today. But yesterday, the Maternity Programme Board, the Regional Board, had its second meeting, and I was present. And they're still in the forming stage, really. That would be where we've just sort of coming to, really find out what we're going to do at a regional level. So the Regional Board has now got terms of reference. they were discussed in detail about who should be on that board. I talked at the meeting about this group, and I'm hoping that I'll be able to sort of share minutes, share presentations with you so you can see what's happening. And once they've confirmed the terms of reference, I can also share those back with you as well. So the regional board will really be about assurance and making sure that better birth is delivered at a local level. The conversations really were the clinical senate, the clinical networks, one for each region. They gave an update on where they've got with assisting the provider organisations with implementing better births, and also the work that they're doing with the CCGs. So as we've got 2 pioneer sites in the south, and the pioneers are to do about are really focused on commissioning and widening, deepening choice for women. They talked a little bit about how they've been involved and sort of what was happening, and really focused on just giving a snapshot update of where they were with looking at each provider and the sort of benchmarking activities they'd done, sort of looking at, you know, where they were next to delivering on better births. So really at the moment all we've got is a sort of a very broad overview of the activity that's happening. And I think as each meeting happens, then we'll get more of an idea of how it will link from national to regional, from regional to local, and then local into the providers, and also from the CCG perspective about what they're going to commission. So those conversations really have started, and it seems a really exciting time for maternity services because they are so high up on the agenda now, with actually having a whole programme of work within NHS England that needs to be delivered on. So for me, it's quite an exciting time. You know, maternity services are very high up on the agenda and are being talked about, and inquiries are being made about sort of what's happening locally. So that just gives you really a sort of quick update, and we're just sort of talking through how this group can really provide a voice onto that regional board and working through how that could happen. So it's been fantastic sitting here, looking at your comments and reading them. And I think, Sarah, we might have to pull together a paper and provide that back to the regional board about how this webinar went and what were the concerns out there locally.
Yeah, that sounds like a good idea.
Okay, well that's it from me.
Thank you, Susie. And we, you know, before we won't finish necessarily for another 5 minutes or so, but I must say, congratulations and good luck in your new post as well. And I'm sure that's echoed by other people. Sarah, we've got 5 minutes or so before we properly round up and finish on time. Is there anything from your presentation or any of the points that have been picked up so far that you'd want to amplify on?
I think just looking through the chat box, there are some themes coming out, aren't there? One's about how you influence, so the relationships. I think is it Lisa who said building relationships with the key people and getting access to that. There's also a comment from Rebecca about the closure of the children's centres and the impact that that's having on MSLCs, because I think quite often they meet in children's centres, don't they? And so I think that there are the issues of the practicalities of how do you meet, how do you engage people, and also how do you link across an LMS. And I think Tim's suggestion that actually they're not going to be merged into quite such big groups is really helpful, but that's still going to be a funding issue. So I think, as Susie says, we draw together a paper and make sure that these concerns are raised in that, and then encourage people to go and engage. It sounds like Tim's got a lot of links that he can send so that people can go and engage with their local systems and make sure that those voices are heard.
Okay, thank you. And I've just picked up a point from Sally in the chat box as well, Sarah. asking whether anyone has experience of engaging with the users to ensure wider voice, and I guess we're talking about demographics and so on there, and equality of representation. I'm just looking through if anybody's replied. I think this, the whole issue of equality and diversity within engagement is absolutely crucial. And some CCDs, for example, really manage it very well, and others might just find themselves doing the easy thing, which is going to the people who speak up the loudest or who are the most, if we might say, middle class or easy to find. So it'd be great if you wanted to share some examples in the chat box or by email afterwards, of course, on that.
I think there are lots of ways of doing that, aren't there? Because there are the people who draw information into MSLCs, so representative groups. But having been on an MSLC myself, we did things like I think a lot of people now have Facebook pages and so on, so they get feedback through that. But also go and hold focus groups if you want to talk to a particular group of women. So, teenage mums or people who have chosen home birth, or, there's all sorts of groups that you can access. And the advertising, as I think someone's saying here, Facebook posters, leaflets, but also making sure that health visitors know about it and that kind of thing. But also that's going to be possibly easier to or more focused when the children's centres go, because people who have social issues are really going to have the focus of what's left of the children's centres. So there might be an opportunity there to really do some engagement work with those groups as the children's centre picture changes. So not great for getting a wider population, but certainly for targeting particular sections of the population.
Thank you. And we're seeing some great ideas. Well, not ideas, current practice coming up, and emphasising the social media as being very effective as well for quick and widespread because of sharing. I'm just reading a comment from Rebecca here. So in trying to engage new mums, why not put a flyer in the birth packs? I'm surprised if you don't, but these are all ideas that sometimes people just need a sudden inspiration and think, well, of course, that's obvious. So that sounds great. And some people saying they do that already. So have we got any final concluding remarks, Sarah, before I just say a couple of things to close?
I think I've kind of summarised where we're at. So yes, thank you, and thank you to everybody for joining and for all your really helpful comments, because I think this will all feed in and we'll make sure that it gets back to the next board meeting. And also, could we just get a feel of whether this has been helpful and whether you'd like a further webinar in the future?
Yeah, please.
And one final one was that Martin's got a Patient Voices website, and we were hoping to put up a page with all the links to MSLCs in the South on that page. So we're trying to collect that. I've got a bit of a patchy database, which is how I've reached the people who we're in touch with so far, but I'm sure there are gaps, or I know there are gaps. So it'd be really helpful if anybody could send in any missing information for that, and then Martin's very kindly going to draw that together.
Okay, thank you, Sarah. And just to clarify, in case people have known you but also known Susie, just remind us how your role in your job.
Sorry, I'm the quality lead for NHS England for the South. So I'm based in Reading in the same office as Tim and Susie, and covering the whole Cornwall to Kent area. I'm actually today in Kent because I'm here for a meeting. So cover a wide patch.
Yeah. So we're getting some feedback from your question about the usefulness of further discussions, online discussions like this. It looks very positive. And what I think was nice about today particularly was that out of we had about 15 people in the one before Christmas and around 15-ish today, and there isn't too much overlap. So I think it's great that some people are able to come to one, others come to another one. So we will never have a discussion with 34 people all being there at the same time, and I think it's great to have refreshing new contacts across the south with yourselves. So my role is really just to be the kind of bit of glue, bringing things together, but not to do the maternity services work directly. But as Sarah said, we've, at Sarah and Susie's request, on the Patient Voice South website, which you'll see the address in front of you, we've got a page called Maternity, and it's very, very much for you to come back to me or indirectly to Sarah and then me to say, could you load this up? So anything that you think's sharing and shareable, whether it's terms of reference, just something that you'd like to share with a wider audience. Obviously, it's the World Wide Web, so it's anybody. Please just let me know, a document, a link, and as Sarah said, if she could create an accurate list of MSLC contacts, that would be good too to put on. So we're just having some final chats. Please do keep those coming in. Just a couple of things from me then. Yeah, please do use our website and contribute to it by just emailing me useful documents or links of us, as I've said. Feel free to tweet about today using those hashtags, which I think are in general use in the